Mr. Chairman, I
For 5
the
minutes.
last word.
Laser.
Republicans believe that strong patient protections are about fairness. We support banning lifetime or annual caps, ending the practice of excluding benefits based on pre-existing conditions, and stopping the practice of health status underwriting, as we've talked about off and on for the last 22 hours. We also understand that in order to have these important patient protections, there must be an incentive to enroll in health care. The Obama administration chose otherwise. They chose to mandate coverage and enforce penalties on every single American that chose not to buy a Washington mandated product. As we heard from one of our colleagues, the gentleman from Pennsylvania earlier, who's been involved in the healthcare industry, when someone buys health insurance, they are buying membership to a healthcare plan that delivers the benefits they choose. Our plan protects members of health insurance, and it's a thoughtful solution that focuses on the needs of health insurance consumers. So when the Obama administration forced and mandated coverage, economists have told us that have sold Obamacare on an inaccurate estimate that the individual mandate would lead to 21 million people enrolling in the plans created by Obamacare. But that's not what happened. The reality is that the enrollment hasn't even reached half that number. And their plans were based on that number. 19.2 million people have actually paid the individual mandate tax or claimed an exemption, which is actually closer to the enrollment projections. And Democrats and their economists can't have it both ways. We don't believe that in mandating things, and we don't intend on mandating things now. So continuous coverage means encouraging and incentivizing individual responsibility in healthcare. We aren't here to tell people how to make decisions about their health. We trust them to make the right decisions when it comes to deciding what healthcare works and doesn't work for them. The important thing, though, is that when we talk about continuous coverage, this is not a new concept in our country. We already do it with both Medicare Part B and D. For Medicare Part B, there's a 10% surcharge on base premiums. For Part D, there's a 1% surcharge placed on base premiums for each month that a beneficiary is not enrolled. Continuous coverage is working effectively for our seniors, and it will work well for the rest of us. It has a proven track record with Medicare. It's led to stable markets that have delivered meaningful results for Americans. And with respect to my colleague's comment with respect to the 30% surcharge, which is in our bill, I find it interesting that the same colleague who has been involved for much of his career in insurance actually found the 30% surcharge to be laughable, and as if it wasn't enough, and wouldn't encourage individuals to continue their coverage. And so in order to make insurance plans affordable, which is what we are trying to do, make sure that we can cover pre-existing conditions, which is critically important. We have heard from our constituents all across the country that that's very important. We have to have an insurance market that encourages and incentivizes people to continue their coverage. And so with that, I will yield any other time, my time remaining, to any other members.